Dr. Ammon, thank you for joining us. There are a number of conflicting ideas. One doctor in Italy saying that actually the virus is clinically dead. In the UK, imposing a quarantine. Some people have masks. In London, there are barely any masks. How should we react as economies across Europe are actually easing the lockdown?
Well, we have put out really some guidance how this should be done, and also prerequisites that need to be in place before you actually can start easing the measures. And that the most important part of this is to have a comprehensive testing mechanism available, so that in the moment when cases seem to pick up, you actually can detect this very early. Otherwise, the risk is that you only realize that cases have increased if it's too late. So in that sense, we have also said that it's very important that these measures are not now lifted all at once at the same time, but one by one, allowing sufficient time in between to see the effect, whether the cases start increasing. And that is why you also need a good monitoring system in place.
But Dr. Ammon, what can you tell us about, for example, antibodies testing? Are people immune? Do people have antibodies? Or is it just a way of tracking who's had it to see how this virus has moved through a population?
Well, we have learned a lot about this new virus, but we don't know everything yet. And so one element of what we don't know enough yet is the immunity. So there are tests, they are not, at least not in Europe, there is no licensed test for antibody testing, but there are, of course, in single settings, validated tests where people, experts do population studies to see which part of the population actually has been in contact with the virus. And from the studies that we have seen so far, it isn't a big part.
Dr. Ammon, good morning from New York. You have been instrumental in the building of the ECDC, and you've got relationships with America and with the World Health Organization. We would love your perspective on what it signals that President Trump is pulling America away from support of the World Health Organization. Will China fill that vacuum? Can Germany fill that vacuum? How will that play out?
I'm not in a position to comment that. I can only say that we are working very closely with WHO, and that is, in our point of view, also very necessary, because our member states whom we work with and whom we work for are also member states of WHO. And we have to make sure that what we recommend and put out as guidance is actually not in contradiction with it.
Dr. Ammon, one of the raging debates right now is school ends in America. Is the ability of children and those younger to become infected. The feeling here is it's a disease, the coronavirus is a disease of older people. What have you observed in Europe about children being back in school?
In general, it has been observed from the beginning when the pandemic started in China, and also now here in Europe, that children are very rarely affected in a severe way. So there are very few severe cases among children. We do not know yet what the role of children is in the propagation of this pandemic. So we are observing now very closely what happens when countries that have actually imposed school closures are opening them again. So and so far we haven't seen a big upsurge of cases.
What can you tell us about the actual virus, Dr. Ammon? We thought this was a respiratory disease. Now we understand that actually there's many maybe blood diseases linked to it. What exactly is COVID-19?
Well, I'm not a clinician, so I don't have the overview of all the clinical features of this virus. But it is very true that among the many things that we learned about this virus are also the effects that it has on the body other than the respiratory system. And I'm not sure we have seen the end of this yet.